Welcome to the 30th show in a series of shows focused on Brookline as an age-friendly community. In 2012, the World Health Organization of the United Nations designated Brookline its first age-friendly community in New England. This was a result of work done by residents of Brookline, the town departments, the select board, and an all-volunteer network organization, Brookline Can, who basically works in the support of residents of all ages. About a year ago, we started the pandemic world and the pandemic year, first pandemic year. And it's a little more than a year as far as I can recall, a little more than a year when we had a sense that something bad was really going on. And we were well into it at that point. Now it's a year later. We have vaccines. And we're trying to get them out. We have a lot of care and protection being taken by all involved, citizens, etc. So today's show, we're going to focus on both the vaccines, the current status, and where we're going from here to some extent. And our guest is the Director of Public Health, Dr. Swannie Jett. So Dr. Jett, many of you may know him. He's been around lately. He's been on various information sessions, which I've found very, very informative and very useful. His past, I'll tell you where he comes from. He came here in 2017. And I will thank the people that appointed him because the timing was perfect. And his previous positions included the health officer of Seminole County in Florida. He was the director of the Bullitt County Health Department in Kentucky. And he served in the past in the military, receiving the Bronze Star Medal in the military for his work at Operation Iraqi Freedom in 2006 to 2008. He's currently, I think he's still currently, major in the Rhode Island Air National Guard. And he's been involved on national level with public health as a past president of the National Association of County and City Health Officials. Dr. Jett holds a doctorate in public health with an emphasis on preventive medicine, prevention. Welcome, Dr. Jett. I want to thank you before you say anything. Thank you, your department, and your team for the work you've been doing in Brookline to preserve our health and to keep us in the yellow as far as the risk status and as we go forward.
Yeah, thank you for having me today. And first I want to thank the citizens that have been very patient with the policies that we have passed. And I want to thank the town departments, the select board, and the various advisory committees, and also the school department superintendent for being very supportive, because it really does take a village and a community to keep everybody safe. And for everybody to understand the importance of things we need to do to mitigate the risk of contracting disease and dying from it at the same time. So thank you for having me today.
Brookline I get around. Brookline, as far as I can tell, is one of the more rigid, it's not rigid. They adhere to obvious things.
Yes.
And I must say that it's a tremendous help. The signs that you've gotten spread around town, near BU, near other areas, in the center of town. The whole constant information and nothing but that about what we should be doing, and very clear what we should be doing, and that helps a lot. That helps the people who want to follow, and they have somebody who leads. So it's thank you again. I'd like to get into at some point the numbers, if you'd like to get started there, to get a sense for what's actually happening in Brookline.
Well, I would go back a little bit in time. It seems like yesteryear. I remember in April, or it might have been early May, we were only at 300 cases. And, slowly as we progressed, if you look at some of the numbers in September, October, we were only at 800 cases. And now when I look at the data, I predicted that, people would travel. We look 2 weeks after Halloween, 2 weeks after Thanksgiving, 2 weeks after Christmas, would be the huge surge. In April of last year, the high point was 74 cases in a week. By the summer, we were only averaging about, 4 or 5 cases a week. Right around Thanksgiving, all of a sudden, we emerged to 80 cases a week, to the peak of 134 cases in a week. So now what I'm slowly seeing is, we are returning back to whatever that normal is, but we're actually down to 68 cases a week, which is down from 81 a week before and 100. So, with this number, we're beginning to be more lax, but our total amount of positive cases that we've had since the start of the pandemic is at 1,800. Total probable cases at 175. Total people that have been quarantined is over 1,400 now. And the total individuals isolated is slightly close to 1,100. So that means we still have right now today about 700 people that are isolated in their homes with COVID. And so that's a large number to continue to think about. Right about now, our deaths are still at 94. So we, majority of our deaths have happened at nursing homes, but now we're starting to see that broaden a little bit to other parts of the community. The earliest that we had is at 50. The range is from 50 to 104 years old. And so that gives you, what can we anticipate, I would say, going in the future. And, I would hate to say I haven't been wrong in some of these predictions in terms of the infection and the rates, et cetera. But I anticipate what you could see because people travel a lot. So if people did travel through the new year, you'll see cases rise. If people travel for vacation, whether it be spring vacation or their vacation with the kids coming up start next week, you'll see cases rise. And then March, you'll see another surge until the weather begins to warm. One of the things I would also just iterate, once we begin to reduce the distance or restriction, like right now, we know the disease can travel 6 feet and beyond. Once we begin to reduce that to 3 feet, the more people will become infected. Studies have shown, and right now it's in the World Health Organization. You can look at episode 4. It talks about reopening schools, and they talk a lot about the transmission in kids. And it's the same as it is with adults. Kids tend to hold the disease less, but teenagers tend to hold the disease at the same rate as adults. And so you think about being, caregivers or grandparents that take care of young kids, they have to still keep that in mind. Because, the death rate tends to be a little bit higher in the elderly, but the death is happening among all age groups. So they still have to practice safe distancing as much as they can if they take care of young ones, hand washing, etc. And so that gives you a little bit about the numbers, what we can anticipate. I do know a lot of people are feeling isolated because they haven't had an opportunity to go out and, do some of the things that they normally would do. So, we can roll right into vaccinations if you want to talk about that, and hopefully that can provide some relief that people can not be as isolated. And
And we're concerned, of course, with the show. It's concerned with older adults, as people tend to watch it, and it's focused on.
yeah,
So in some cases that isolation is bad. In some cases that isolation is not so bad, because people, in many cases, they're more used to being. People say, well, the older adults are isolated. That's a real problem. But there's also, they're able to stay isolated because they've been doing it before, and they've been living with support that exists. So following the rules. Following the rules is something I think that can be done for older adults, and they can still have an activity. People have learned to Zoom. People have learned to do a lot of things that substitute for the contact, not full substitute. Everybody wants to get back, and a vaccine is the light that everybody's looking for. But I look at vaccine as something additional to social distancing, additional to masks, additional, so that we can feel a lot more comfort that when we do the things we need to do, that we're less likely to get ill. But it doesn't take away the need to protect yourself, does it?
correct. No, it doesn't. In fact, there's no study to show the vaccine will last longer than 6 months. So, with that in mind, you still have to do all the safety precautions. Research is still being done on the different variants and how well the vaccine will work against those variants. And we really don't know. There has been a lot of ideology that the UK variant may become the dominant variant in the US,
Right.
but I think that's still yet to be known. So I think people still have to practice the safe distance of 6 feet, the hand washing, wearing your mask properly, and limit your surroundings to only the people you have been around during a pandemic. And hopefully you trust those friends to know that they have done the same thing as you have. And I know, if you're cooped up in a house, or just like being in a cell for a long period of time, it does hurt mental health aspect. So you do need to move around, but I would just ask people to, be safe as always, because we're still in a pandemic and we are still losing people each and every day.
So the vaccine, a couple of questions just we discuss different categories as we go in. We discuss ages, like 75 plus, 65 plus, 85 plus. We discuss comorbidities, right? And things that float past, like diabetes or immunocompromised or things, BMI. I hear all sorts of things floating. I don't know what that means. What are two comorbidities? What is the difference between 65, 75, and 85 in getting a vaccine? What are all these risk factors, these categories?
Well, my ideal, and what I've seen is they started by what was the highest mortality. So in Brooklyn, I know for a fact that the highest rate of mortality is that 75 and up.
Okay.
And so that's the first group. In fact, that would have been the first group that I would have identified to vaccinate first. Because usually you base your vaccination schedule off of who's impacted the most. And then you move down the chain to who's impacted the least. And so you use data, and data usually drives that. When you start looking at people with two comorbidities, so we already know by the data that mainly African Americans were impacted disproportionately at higher rates for two comorbidities. And this just happened recently, as far as yesterday. A guy I knew won 5 state football championships named Ty Scroggins out of Louisville, Kentucky, 49 years old, wasn't really overweight, but could stand to be probably in better shape, but died at the age of 49 due to COVID. And so, you know, I've seen this over and over again in the news. Tim Lester, that played for Pittsburgh Steelers, age 52, died about 3 weeks ago. He was Jerome Bettis' lead blocker. He went to Eastern Kentucky University. So you start looking at, you know, people dying in the African American people, their race, they are dying at a younger age due to comorbidities,
Yeah.
which diabetes is one of them, hypertension, you know, CVD.
Yeah, right.
And so, and things that affect respiratory, such as asthma, et cetera. So that moves people up the chain. And so what you hear now on a national platform is that the vaccine, if you already understand the vaccine is not being distributed to the hardest hit, which is 75 and older, and African Americans and Latinos with 2 or more comorbidities, then it's a flawed process.
Right.
And so.
Yeah. Yeah, that's I guess I understand. So now we're getting the 75 plus. We're supposedly, I guess that's the purpose of having big centers distributing, is in order to get to highly dense populations. Is that the idea? Or you may not know, but that's the state parent purpose behind it, right?
Well, I think the state or the governor's office probably was really looking for how to establish mega centers where people could come to.
Right.
But it's very unfortunate because a lot of people do not have the ability. If you open up a site, now it's open for 75 and older, you know, there's people that don't drive. So, and you know, now we move into a phase where if somebody is a caretaker of somebody 75 and older, that they can get the shot. And so, you know, I want to caution everybody, if they're not in the MRC, Medical Reserve Corps, or they're not part of CERT, where they have already been quarried, background check, if it's not done through the town, I would not just look for somebody as a caretaker to take me to go get a shot, because there's a lot of scams that could be happening on people setting up companies on Craigslist or Instagram or any of these social media or other platforms. And I would guard against that because number one, we want to make sure that people get to sites safely. Number two, I'm hopeful that, you know, maybe CVS or Walgreens, which are these hubs now in communities, will start to get the vaccine. I have committed to whatever doses the health department receives, which I've requested 100 doses each week. We haven't received anything to really do 75 and older. But once we do, we're committed to making sure that we provide the vaccine to the community at that time.
Now, I think people know the vaccines. I wanted more to communicate, but they are the AstraZeneca and the Johnson & Johnson are not available in this area. Is that correct?
That's correct. The only thing that's available in this area is Pfizer and Moderna.
Yeah, I got Pfizer at Fenway, my first shot. And in fact, I'm going for my second, and I discovered they changed the rules today. So my wife, who is under that age, can now get it because she and I are together, and she drives me there, and we're partners in the house. So apparently she can now get it. And that's true with everybody, 65, under 75.
That's correct.
Right. So that's a change, and that I'm looking forward to. People, I know a lot of people in that situation. They just happen to be 76, and their spouse happens to be 74, and they couldn't get it. One could get it, and the other couldn't.
Yeah, that makes plausible sense, and you're in a perfect situation. A lot of people that might live at home don't have that scenario, and what we don't want is people to look to Craigslist or take somebody, a stranger, to drive them to one of the
It's
sites.
happening, isn't it? Because I see just on in various Nextdoor and other various things, people offering to drive somebody in order to, so they can get, and they're open about it. They're saying, because they also like to get the shot, and they're offering to drive. But I keep thinking, who is this offering? Nobody knows them.
Right, right, and we have to be careful about that. And it's interesting because the vaccines are not in enough abundance for everyone. People are looking for ways to game the system in order to get a vaccination. But while this is going on, people they have to be safe. And it's specifically, you don't want to be a predator to somebody trying to game the system for vaccination. And so, we're very concerned that seniors might be taken advantage of. And so we don't want them to, get rides from random strangers, people they don't know.
And that's really good, because I have heard people talking about the rides and nobody put that together. So that's really important. What about the senior center? Is there any work being done with them in Brookline? Is there?
So we do have, so we've already vaccinated home health aides that work with the senior center, but also we're working with Brookline Housing Authority and also senior center. So when we do have the ability to provide vaccines to them, we've put in an app, we've requested to the state. I don't think they would make it available until later on this month, when we'll be able to apply for the vaccines, and then we're going directly to senior housing to be able to administer it at that time. So we have it planned, but we don't have the vaccine to administer at this time.
This is the public housing, right?
That's correct.
So it's not just because I happen to be older and live in a house.
Yeah. No. This is Brookline Housing Authority.
Senior housing at all levels. That's what my concern was. My concern was public housing. Because I felt like that's something you would be able to take care of. As far as well, I don't know. Do I want to go that far? I wanted to talk about future diseases, but I have trouble reaching beyond the present. I was asking, are we ready for the next one? Are we ready for next year with variants? Are we ready? Is there something, is there a process going forward? And I'm not worried about the country, and I'm not worried that much. I'm worried about the state, but I'm really worried about Brookline.
You bring up an interesting point. In 2019, every year I do a briefing, military, about epidemiology and infectious disease, and what we can expect. And so I track diseases all over the world, and I predicted that within the next year, I told we would do in 2019, within the next year of an epidemic or a pandemic. And I gave that presentation like August, September of 2019. I still have the presentation. And so, again, what I foresee, just because of how we travel now, Usually diseases would be maintained on a certain continent or a certain country, but global travel impacts how diseases are spread. And so the next 2 or 3 years, you can anticipate that there'll be something more potent, similar to SARS-2, we'll be talking about SARS-3, or something a little bit different. Um, More and more, what I'm noticing is zoonotic diseases are jumping to humans. And so, and people don't know, they get on a plane and then they travel to another place. And usually by the time the disease begins to manifest, whatever that incubation period it is, that person, if they're not exhibiting symptoms, they have already spread it to 10 people. If we don't have a test readily available, then it's spread even further. And so if you think about in the US, we really didn't have a test, and it was manufactured, not at CDC. Somebody sort of designed a test on their own, and they happened to find COVID in February in Seattle. So if they had not did that, then we wouldn't have been notified in March. But I was actually watching the reports coming out of China in December, and I watched the numbers creep in January. And I remember people begin to ask me about Lunar New Year and let's continue to have these events. And I put a pause on it because I said people are doing a lot of travel, and I was quarantining people in early January. So, the future right now, what we should learn from this, and in particular Brookline, is I would stock up on N95 mask if you could find it, not just face coverings, N95 masks. Because at one point you'll be able to go purchase them. I will put them in my home now. I will begin to maintain supplies. If you remember all the supplies that you could not get in a pandemic, I will begin to stockpile it. This is emergency
Not
planning
necessarily
101.
toilet paper.
Yeah, yeah. And so you could be prepared for when something occurs. And because it's just a matter of time for something to happen again. And at least at that point of time, you will not have to rush to the store. You can be isolated and you will be able to wait it out. And to me, unfortunately, that's where we're headed.
So the key, what I'm hearing, the key is that we have to be conscious of the community, Brookline, the people all around us and ourselves, and be aware that diseases are one of the things we have to be aware of for the community, and we have to deal with on a communal basis, on a community basis.
Correct.
Community-wide basis. And that's, and we have to keep aware of those things, and everything you mentioned and anything that comes up, and we learn about things as they go. And please don't go anyplace, stay here.
Stay here. And, but I would also, as I do, I look at the World Health Organization all the time to look and see what's the latest and greatest. Some of these diseases, and because I am in the Rhode Island National Guard, and I'm a lieutenant colonel now.
Oh,
so I do the same thing for them. And so, I'm helping administer vaccinations right now in Rhode Island. But also, anytime our soldiers travel abroad, I conduct a risk assessment, and I do a public health briefing, and I look at diseases in that country. And so that's how I found out a lot on how to protect soldiers when they travel. And so, World Health Organization is a good piece. I have other resources that I have of the medical intelligence community, and that's how I'm actually alarmed as to what's going on. But I would say mask is here to stay, and I would advise people to purchase all the masks you need. Make sure you continue to wash your hands, stay safe, and if you do travel, those same practices apply, and that's the key.
well, I think we could go on and on, but
Yeah, I can stop there.
I have to stop timing it. because I didn't want to stop us, but so I have no idea where we are, but people, they'll take, Big will take care of it, and it'll work out well. But I want to thank you again for coming in. Anytime, come in and chat, because we're spreading out, this show's being seen by more and more people, and I'd like them to keep in touch with you.
Yeah, and I would just add, you know, in closing, you know, people can continue to look at brooklinecovid19.com to look for the latest information we have. We're also putting out a press release and information about what seniors should not do and how to prepare if they want to get a vaccination. But also, anytime we receive information on vaccination and doses that we may have, that's the website to check. We do have a waiting list of seniors, so we will be calling once we have a vaccine. And the vaccination place will be at Town Hall. Eventually, we'll probably shift the vaccines and be able to distribute it from the health department as well. And if anybody needs to get a test, the Denny room is where we're still doing testing by Empathy. That is open for another month. So, you know, I advise people to still get tested. And if you travel, please be safe.
Thank you. Okay, the show again will be rebroadcast several times over the weeks to come. And the Brookline Can website, it'll be available at any time. And in Twitter and Facebook accounts, it'll be spread out. I want to again thank Dr. Jett, and I want everybody else to take care and be safe, and thank you for watching.